3 days of the UK MP exchange visit come to an end. Good day, this is Jose Molete reporting for Show Me Your Number online radio. Day 3 began in the heart of Johannesburg with a site visit to the OST Clinic in Yeoville. This clinic, supported by the Global Fund, serves as a vital hub for community health services, where the delegation received impactful teachings on HIV/AIDS and sexually transmitted infections. The visit highlighted the importance of continued education and access to treatment in the fight against HIV.
We should be prioritizing harm reduction needle and syringe packs. We should be prioritizing safe smoking packs. We should be prioritizing methadone programs and hepatitis programs. But none of those programs will work if we don't have structural interventions that focuses on human rights violations and reducing stigma and any barriers to access to services.
We are very excited to have UK delegates here to specifically showcase the need for harm reduction services expansion, not only in the 8 districts we operate in, but further, because we've only scratched the surface about the number of people who inject drugs that need opiate substitution therapy, that need hepatitis treatment services, and that need clean, sterile needles and syringes. So we're calling for expansion of services and funding to South Africa to provide not only biomedical services, but also key psychosocial counseling through social workers and human rights interventions through legal access to legal justice and legal services.
I'm one of the people who are drinking methadone. I'm happy to be here today because I had a chance to speak for me and for my brothers out there. It's been a lovely journey to be in this journey of being clean and not using drugs anymore.
I lost my younger brother last year, August. He overdosed crystal meth. Yeah, so he is the one who made me to change my life, because he was also, we were registering to be here, both of us. Unfortunately, then he died.
I accepted to face reality without drugs and be sober, and I think the program a lot. It's helped me a lot, and hopefully I want to also help others like me who are in this situation get out of the situation.
There is a PY program. It's where I enter. I study plumbing. Then I pass, and I've got a certificate, and I have a toolbox. Okay, I'm blowing up, every growing up. I be with the squad, we toasting up. What I say, thank you. Me, I feel breathe. Get on my knees and my head to the sky. When in the dark, hella lost. Help me shine a little light on my. We have cotton wool in here for them to wipe, the blood when they finish injecting this. They use before they put the needle in, they wipe their skins. Just once done, we don't encourage them to rub because that's just spreading the dirt. So they must wipe once, like I say, we teach them the correct way. And then the water is very important. They can't use water in the street because it becomes hepatitis, because it's dirty and that's no good. So water in our packs is extremely important to them. You give me the love I need. Let me be who I wanna be. You give me the love I need. You let me be who I wanna be.
The second stop took the delegation to CPC Westrand in Krugersdorp, where they engaged with the sex worker program.
I feel thank you. Me, I feel change your life and mine. Lord, I say thank you. Me, I feel breathe. Get on my knees and my head to the sky. When in the dark, hella lost. Help me.
This initiative, led by the SMYN Civil Society Forum Coordinating Committee, provides critical support, advocacy, and care to one of the most vulnerable populations. The visit underscored the importance of inclusive community-led approaches in public health.
So we are working with sex workers in all of the sub-districts in Westrand. We have a cohort of about 4,500 sex workers whom we are servicing, providing HIV and AIDS education, advocacy work for human rights, because their human rights are being violated as well. We are also servicing the children of sex workers and also minors who are selling sex, something that is a complex situation and also a painful one. But we help them to make sure that they manage to see a social worker, get psychosocial support, and to link them to Department of Social Services. We also have an advocacy officer who assists with human rights violation cases to ensure that their human rights are not violated. If they are, then they get representative. They get the representation that they need and legal support. Excuse me, and legal support to ensure that their rights are respected. We are also we provide HIV testing services, and for sex workers who test HIV negative, we ensure that they're initiated on PrEP, because we do have professional nurses that initiate on PrEP. In terms of at initiation, if someone tests HIV positive, we link them to the local clinics that we work with, and they're initiated immediately. We also work with clients and partners of sex workers, because especially in terms of human rights violations, they're one of the main perpetrators of human rights violations against sex workers, and that includes GBV.
So the police were actually abusing sex workers from that side. It will go as far as some of them sleeping with them in the cells, arresting them on a daily basis so that they can reach their target. And then we realized that this is a problem, because now we have a cohort of sex workers where we're supposed to return them on PrEP, some of it's supposed to be on ART, but it was very difficult to do that. At some point, we even went as far as our nurse would wake up in the morning, take food to Richmond, so that they can just keep them together there, but they don't find them. So we had a sensitization workshop to deal with human rights violations only at the time. They would be arrested. They'll probably spend more than 72 hours in holding cells. On Monday morning, they are released, and then they go through the whole process as if they're going to court. But when they go to court, instead of going to see the magistrate, they are told to leave, and they never repeat the offense again. Sometimes they're forced to clean the cars inside the magistrate, or sometimes they're forced to clean the offices as well.
So currently what happens is when they do come through our programs, they are referred to the Department of Social Development. So I think the main outcome of that is to integrate them back into school. So we do have like a lot of follow-up engagements with the minors to take them off the streets and then reunite them with families for those that are misplaced.
Okay, ngasho ukuthi mina la ekhaya ngize ngokuthi sithola ama services agrand. Yabo? Afani inhleki nase emakliniki. Yeah, understand. So into abasuka besisize ngayo ukuthi ayikho into abangasizi ngayo noma yini oyidingayo. Ijima ngasho ukuthi khona babe befuna amaphepha, khona babe ababeshota nezinto, ama certificate and stuff. Sonke yonke into bayasiza.
Ngilapha nje akusikuthanda kwami thanda kwenkosi.
The day concluded at the Civil Society Town Hall, a vibrant gathering of community leaders, civil society organizations, policymakers, youth and development partners. This pivotal meeting focused on a clear and urgent message. World leaders must prioritize a fully funded global fund to sustain and deepen the impact of health services at community level. The discussions echoed a unified call for continued global solidarity and investment in public health systems that leave no one behind.
So I believe that from today, we are going to send a feedback to our colleagues that we are working with, that this is the initiative from our district and from the UK. So now from today, we believe that as Merafo, we are going to be revived, we are going to implement, we are going to mitigate for the needs of our community. Thank you.
And I think we are more encouraged to say that we will do everything that we can. And with the support from the global funds and every other stakeholder, we would be able to reach even higher and higher and higher and higher levels. But we need to find that collaboration. So from my side, standing for the Civil Society Forum of Magale City, I would like to say thank you for your initiative. May it not be the last time that you do that. May it be a continuous relationship that will see both our communities and the society as a whole grow from strength to strength. Thank you very much.
This is Show Me Your Number online radio with Kuseme Molete. Thank you.